everyone, this is Teacher Aya, your host, and welcome to another episode focusing on the Sustainable Development Goals. In today's episode, we will talk about SDG 3, good health and well-being. Globally, about 1,400 infectious diseases afflict the human population. Some of them are the most important causes of death in developing countries. SDG 3 aspires to ensure health and well-being for all by 2030. It also aims to achieve universal health coverage and provide access to safe and effective medicines and vaccines for all. Joining me in today's conversation relating to the issues of health and well-being in their respective countries are Teacher Sandy from Cambodia and Teacher Achi from Cameroon. Teacher Achi, how do you take care of your physical and mental health?
Okay, actually, I'm a sports person. I love working out a lot, actually. And every morning before I start to work, I get to jump ropes. I love rhythm, something that gives me a rhythm, yeah. So I jump rope for about 1 hour. I have different sets that I
1
do.
hour?
Yeah, it keeps me going. It gives me the boost that I need every morning. Yeah, and a lot of energy, And aside that, I also make sure I rest a lot.
As you know, the world is facing a global health crisis, which is the COVID-19 pandemic. So what do you think are the physical and physiological effects or psychological effects of the current pandemic on child health in your country?
The pandemic has really caused a lot of damage
Yes.
in the country and the society, especially in Cameroon, because it has caused a lot of fear among children. Children tend to be scared
Yes.
because of the news, CNN news, mainstream media. They give a lot of fear to people, and they're kind of to socialize, especially with socialization. They are so scared to socialize with their friends. So it kind of creates a distance with people, which is not very, very good for children. Children need to grow up, loving and caring for each
Yes.
other. But now it gives them a mentality of separation. So it's really affecting them in a negative way, I think. For kids, it's a little bit difficult for kids to social distance from each other.
Yes.
Kids are very interactive, yeah. So it's very, very bad for them because they tend to cry a lot. They want to be with their friends, so they don't have the opportunity to be with their friends. And at school too, they try to say, no, don't keep close to each other. So it's very hard for them. It's really hard for them.
Everyone is suffering,
Yeah.
including the children. Now, what
Exactly.
are the health concerns in your country?
Wow, Cameroon has a lot. Cameroon, tropical Africa, malaria.
Yes.
We have malaria is very, very prevalent in the country, and it's the highest killing disease in Africa and Cameroon. So a lot of people, I would say education, since maybe majority of the population are not educated, they don't know how to protect themselves against malaria, because malaria is very easy to protect or to prevent against getting malaria. But since people are not educated and they don't know what they need to do, so education is it's kind of really related to health because they don't know what to do. Yeah. So
Yes.
I think malaria, and then HIV, the youth
HIV.
youths are really involved. Yeah, HIV and AIDS. I don't know if you know that.
Yes, of
I'm sure.
course. I
Yeah.
see.
HIV kills a lot of people, and especially with the youths. And social media, kids nowadays, they're exposed to a lot of adult content which are not healthy for them.
Yes,
So I
exactly.
think, yeah, it's in turn gives them a bad image of themselves. So I think, yeah, malaria, HIV, and coronavirus.
Of course. So, with regards to that, how is the healthcare system in your country?
Oh my God. The healthcare system I would say is the best, but I think they are doing the best to provide for services. But for healthcare facilities, a lot of people don't have access to proper medical care, basic medical care, because number one, the roads. We don't have good roads, and right now we have some political instability, so it gives a very, very challenging issue with the doctors getting to meet the patients. People could be sick for days and days, but they don't have the access to hospitals because number one, they are not good roads. It's causing a lot of issues. So the infrastructure, and Cameroon now has really been hampered with the crisis. I don't know if you know about the Anglo-Saxon crisis in Cameroon. So the leading hospitals we had has been destroyed. So people are dying
Really?
at home.
Oh my
Yeah.
goodness. Why is that?
Cameroon is English and French speaking country,
Mm,
and the minority of their population have been segregated. They have kind of been considered
I
over
see.
years as second class citizens, and they are not really happy. So they really want their own independence from the French speaking government. So this now has caused,
Inner conflict.
conflicts.
I see.
Yeah, the majority is the French speaking. So now, guys, they're fighting. We have separatist fighters. When two elephants fight, it is the grass that suffer, right? The hospitals are
Exactly.
burned down.
The people are
The
suffering.
situation, people are suffering. Yeah.
I see. Now, what are the health initiatives then done by your government, to help the people in Cameroon?
Wow. Actually, the government always see into it that people get free malarial medicines,
Oh, okay.
free treatments. Yeah, they always make sure they do that. Even though it's challenging to get to them, but they always make sure on a yearly basis, they give free consultation services to people, especially people who are in critical situations. And also, they also give out, after every 3 months, there is a mosquito net campaign.
Mosquito
They
net
make sure every
campaign.
household gets a mosquito net. Yeah. So with that, no mosquito, no malaria. So they're
Yes.
trying to tackle.
But I'm happy that there are some initiatives, taken by your government. At least they're doing something. They are not passive about the health concerns in your country. So that makes me really happy.
Yeah, that's true. They are always doing the best to make sure the situation gets better, even though it's not really that effective, but
At least.
the efforts are all there. Yeah.
All right. Thank you. Now, how do the people in Cameroon perceive health challenges and how do you try to overcome the situations?
Actually, the perception, yeah, most people in Cameroon, they think the government is not doing a lot, you know, and the issue is corruption. Corruption is a big issue too
Yes.
in Africa and especially in Cameroon, because when the government releases some medical kits or facilities, they try to, embezzle the funds, the money, so it doesn't get to the people, and the people are not really, really happy with this. So people just try to protect themselves because they know they are getting little or no help from the government. So they always try to make sure personally we keep healthy,
Yeah.
and the best way is to eat healthy food, and they try to do physical activities. We join gyms or some clubs, some aerobics. Yeah. So people on their own part, they just try to keep healthy.
All
You
right.
know, they are tired of waiting on the government
Correct.
because the assistance that comes from the government is so minute. So
Mm.
they always try to keep themselves safe, like me.
Wow, and you're healthy. I can see. Very fit.
Yeah, very healthy.
Now, we're down to our last question. Teacher Achi, do you think we will be able to achieve SDG 3 by 2030?
Yeah, I think globally we can do that by 2030. We have about 9 years. So I think, but with now this issue with the coronavirus, I think it's gonna be a little bit harder to achieve that because people don't have the vaccine, and a lot of people are refusing to take the vaccine. So
Correct.
it's a huge challenge. People cannot do all the WHO. They might not have it easy to get through their goals. So it might be a little bit harder. I think it's possible if everybody responds. But if everybody doesn't respond to this pandemic, which is the first issue, I think it's not gonna be
Easy to achieve.
possible.
All
Yeah, to
right.
achieve that. Yeah.
Please tell us about your country, Cambodia.
Cambodia, well, right now Cambodia is doing far better than before. If you just give your time in researching about Cambodia, Cambodia has been through a lot when it comes to war and everything, especially during the communist regime that started from 1975 to 1979. All of the aspects in the society went down to zero. Healthcare, education, and everything, religions, because the Communist Party didn't like religion and everything. So all the aspects went down to zero. But I think Cambodia started to rebuild itself from 1993. I think for me, I think it was the starting point. Yeah, it was our first time to be able to conduct the democratic election hosted by United Nations.
And until now, they're still helping you guys, right?
Yeah.
All right. How is the healthcare system in Cambodia?
Healthcare system in Cambodia so far is going better. As I've told you a while ago, during the communist regime, when it comes to healthcare, it went down to zero, no hospitals. And but after the election, after 1993, the government trying their best in rebuilding those health centers and hospitals across the country. Yeah, so when we try to compare about those time and right now, there are many developments going on, but still we are in need of the qualified nurses and doctors in Cambodia.
Same in the Philippines. Now, as you know, the world right now is facing a global health crisis, the COVID-19. What do you think are the physical and psychological effects of the current pandemic on child health?
Children feel bored. That's a simple thing or sign I have noticed. They feel bored. They need to be with friends. They need socialization so much. And when we try to keep them in one, just like four corners of their room, I think that's not a beautiful decision. And so I hope that those parents are able to help their kids well while they are staying in their house. Oh yeah.
We have a lot of students who are parents right now, so that is a good thing to say. You know, they can let their students enter NativeCamp lessons, so the kids will be happy talking to teachers like you. Thank you so much, Teacher Sanji. The next question is, what is a great way to promote environmental health?
Sharing good quality of information is important. So I think social media is also important in spreading those news, remedies, how to take care of one's health, overall being, not just physical, but also emotional, spiritual. I think we, not just I, but I think we must do our best in helping our friends out, taking care of one another. It's kind of advocacy, actually. Yeah, it's a long process. It's a long thing to do. Yeah.
I love how you emphasize, helping one another. Like, we cannot just focus on ourselves. We need to ask some of our friends, like, are you okay? Actually, all of our friends and family members, because someone might say they are okay when deep inside they are not, especially nowadays. Are you okay?
Oh yeah.
Good.
And I have one advice. I mean, in case young people will be watching this video.
Yes, of course they are.
Oh yeah. The thing that I want to say is, if you know someone who appears to be strong in front of you, don't leave them out. Because even strong people, once in a while, they also get discouraged. They also get sad, but they just don't want to reveal or show these all negative aspects to the people around them. But they also do need cares and love from the people around them too.
Well said. What about you? What type of personality do you have when it comes to handling the problems that you have in your life?
Well, I think, for me, I would say I'm just okay. Most of the time I try to cope up with my problems and challenges in life. And I think, so far I'm doing fine. I'm doing good. I never ever gone into depression, even though I'm living in the Philippines for over 1.5 years now because of COVID-19.
Actually, that's what I was worried about. Yeah.
Oh yeah. And this is the blessing that I have found NativeCamp.
Aww.
Yeah.
And we are here for you, okay? You can talk to me anytime.
Oh, you're so kind, teacher. Yeah, and I think people around me looked at me as a strong person too. They think Sunday is a strong guy. So yeah.
You do seem like a very positive person.
Oh, thank you.
You're welcome. All right. Now, what are the health initiatives done by your government to help the people in Cambodia?
Oh, that's a good question. Government keep having communication or trying their best to maintain the foreign communications with other countries. We received so far supports and supports from Japanese government when it comes to healthcare.
Really?
Oh yes, we are so blessed with that. In terms of medicines, once in a while, Japanese government would send volunteers to help hospitals. I mean, public hospitals in Cambodia. We receive supports from United States, from UK, from Australia. Australia also do care a lot for Cambodian healthcare, and so far we are so blessed with all of these supports.
I'm happy to hear that. Do you think that we will be able to achieve SDG 3 by 2030?
I believe.
Oh, why?
First of all, I think people are so aware of all the things that are changing right now. They are so aware of the global warming. They are aware of the viruses and sicknesses around them. They are so aware of the technology. And so, well, it won't be absolute that every countries would achieve this, but I think most countries could achieve this. Like Cambodia, young people right now, they are so enthusiastic in helping each other out, sharing informations and be positive, and they just give themselves in learning and researching, and so I believe in it.
Yeah, we just need to stand united, right, in facing the problems. All right, and we are down to the last question. How can we achieve good health and well-being?
Wow, there are so many ways.
Yes, you've already mentioned some of them before.
Right, but I think the fundamental point is it should start within individual's life. It must start first from me.
Yes.
I know medicines are good. Healthcare are beautiful, but it should start with me. I must take care of myself for overall being. I must be aware of the things that I'm going to eat.
Yes.
My emotion. I must know properly how to handle my emotions, and so I think this is the starting point. And secondly, I will depend on my country, my healthcare and everything, the beautiful people around me. Those people are very important in helping me to achieve this kind of overall well-being.
Very well said. I like that you emphasize in concerted efforts, which are really required to achieve the goal by 2030. And you mentioned that it should start with us, right?
Yes.
Everything should start with us, because we cannot help someone if we need help ourselves. So that is a good reminder for everyone watching this video right now.
Oh yeah.
Thank you for watching. This is Teacher Aya, and we hope that you have enjoyed watching and have learned something from this video. Creating better access to good quality health care for everyone, especially for the poor, is a major challenge to development. The impact of COVID-19 pandemic to mental health is also a global concern. To solve these problems, we must bring about the voice of care and altruism. The economy must exist to serve the society, not to be served by society. Everyone, please stay safe, be well, and I hope to see you guys again in the next video. Ata ne!